Let me tell you something that may sound counterintuitive at first. Some of the best patient care happens when you see fewer patients, not more. For years, we're taught the opposite. More patients, shorter visit, faster pace, as if medicine were a race. But real primary care doesn't work that way, and neither does the human body. Here's what I've learned after nearly 2 decades in primary care. When you slow down just enough, when you give yourself a little more space per visit, everything changes. Not just for you, but for your patients as well. First, patients feel seen. When a patient knows they have time, real time, they stop rushing their story. They remember the symptoms they almost didn't mention. They share the stress, the sleep issues, the family concerns. And very often, that's where the real diagnosis lives. Some of the most important medical decisions don't come from labs or imaging, they come from listening. Second, you connect the dots instead of chasing fires. When visits are rushed, medicine becomes reactive. We fix the loudest problem and move on. But when you have time, you notice patterns. How stress is affecting blood pressure, how poor sleep is worsening diabetes, how untreated anxiety shows up as pain, fatigue, or a GI symptom. That's prevention, that's real care, and that's what keeps patients healthier long term. Third, your documentation improves and so does your clarity. When you're not sprinting through the day, you document what it actually did. You think more clearly, you make better decisions, and patients feel that confidence. They trust you more, not because you rushed to the next room, but because you are present in this one. Fourth, and this matters, patients don't want to rush care. Patients don't remember how many patients you saw that day. They remember whether you listened to them or not, whether you explained, whether you cared. I've seen this again and again. When patients know their visit is meaningful, they cancel less, they follow more, and they engage in their own health. Quality creates loyalty. Loyalty improves outcomes. And here's the truth most people don't talk about. Seeing fewer patients doesn't mean doing less medicine. It means doing a better medicine. Medicine that prevents complications. Medicine that catches problems very early. Medicine that treats the whole person, not just one symptom. And yes, it also creates a more sustainable, humane career for physicians. Because a calm doctor is a better doctor. When you're not exhausted, you notice more, you think better, you care deeper, and patients can feel that immediately. So if you ever felt torn between caring deeply and surviving the day, I want you to know this. You don't have to sacrifice patient care to protect yourself. In fact, protecting your time often improves care dramatically. Hi, I'm Dr. Gani, and this is what thoughtful, sustainable primary care truly looks like.